Hello, Treasury Sleep Clinic. How can I help you today?
Hi there. I need to rearrange an appointment, please.
Of course. Can I just take your name, please?
It's Catherine Templeton.
Thank you. I will just load up your details on the system here.
Alright.
There you are. Okay, so I can see you have an appointment booked for next Thursday morning at 9:20, is that right?
That's right.
Alright, when would you like to come in instead?
I could do later that day, after about 2:30, or any time on the Friday, really.
Lovely. Okay, let me just see what I can do here.
I appreciate it, thank you.
That's no problem. Alright, it looks as though we won't be able to do Thursday because we are fully booked on Thursday, unfortunately, now. Friday is quite busy too, but I think I could probably squeeze you in for about 10 o'clock that morning if that would work for you.
That would be perfect. It's just for my initial consultation.
Yes, that's correct. It just gives us the chance to determine the best course of treatment for you and of course to answer any questions that you have about our clinic.
Wonderful. Thank you.
You're very welcome. Okay. There you go. So that's all amended for you and your new appointment is at 10 o'clock next Friday morning.
Great.
We'll send you a text reminder, so can I just confirm that your number is ending in 328?
Yes, that's right. Thank you.
Not a problem. Is there anything else I can help with today?
No, that's it. Thanks very much.
Okay. See you soon.
Bye.
Bye. Okay, so let's just give
Welcome to the EE voicemail. I'm sorry, but the person you called is not available. Please leave your message after the tone.
Hello, Mr. Watson. This is the Treasury Sleep Clinic. We're just calling to confirm that your results from the audiology test that you had the other week are now in. So if you would like to call us back, we will run through those results with you. Thank you. Bye. Okay. Let's get this email sent and then to Mrs. Parker. So, dear Mrs. Parker, thank you for your inquiry. We are a private clinic specialising in sleep disorders and associated conditions. I would suggest we book a free initial consultation with the Treasury to assess your situation and answer any questions that you might have. Please feel free to call if you would like to book in again. How are you feeling today? Oh, don't worry at all. There's nothing to be nervous about, and we'll take really good care of you here, alright? Good. Okay, I'm going to load your details up on the system quickly so that we can get you checked in. Let's have a look here. Have you had any minor operations at all before? No? Absolutely fine. So what I'm going to do is run through a very straightforward check-in process with you, and then I can just answer any questions that you have about what's going to happen, alright? Lovely. Okay. So I need to get some formalities out of the way first. So do you have any kind of photo ID with you? Perfect. Yes, please, yeah. Good, okay. Lovely, so I will just have a look at this one. Okay, great. So I will need to add in the number there. And I'm just going to get a scan of that one if that's alright. Okay, so I'll put that one into the scanner down here. There you go, there's that one all done for you, alright. So, I can see you are booked into the deluxe double suite for an overnight stay. Absolutely, no, that's a great choice. It's very private and really comfortable, and it just means that you can rest and recover after your procedure in your own time, really. That's it. So you could, with this particular procedure, leave the same day, but I think you're doing the right thing because it's quite late in the day that you're having the operation, so it means that you won't have to rush yourself home or anything afterwards. That's it. Absolutely. Okay. So there are, before we do the health questionnaire, there are a couple of options in terms of dinner. So we have, of course, the restaurant that's on site, and that's where you'll be having your complimentary breakfast that we provide when you book the room. So you can also go down there and have dinner if you'd like to. If you are feeling up to it and you'd prefer some fresh air a bit later, then there are several really nice restaurants in the area that I could recommend for you. Or if you would prefer, we do have a special guest chef in this week, Michelin starred, and we could order for you a 3-course or 2-course menu to be delivered to your room for room service. And if that doesn't take your fancy, you are of course more than welcome to order some takeaway to your room. Yes. Of course you can, absolutely. So with the 3-course meal by our special guest chef, you would need to book that in advance and pay. So I'd need to take your menu choices now and take a payment card if that's all right. Yeah, absolutely. Would you like me to run through the menu with you? Okay. So let's just see. There it is. Lovely. Okay, so I have the menu here that chef sent through. Are you thinking of going through the 2-course option or 3 courses? I think that's the right choice. You're nil by mouth for 12 hours, aren't you? Yeah, so I'm sure after the procedure you'll be feeling quite peckish. Okay, right, let's have a look then. So it's quite a delicious sounding menu, so I don't envy you having to make a choice. So a couple of options for starters. You could have roasted king oyster mushroom with watercress oil, toasted hazelnuts and a mushroom crisp. That's of course a vegan option. Then we have salmon and spinach fish cakes with lemon mayonnaise and a dill salad. Absolutely. And if you fancy something a little more for your starter, then we have confit duck leg, oriental vegetables with honey and soy. Okay, so those are starters. Then for mains, we have an option of celeriac steak, red wine lentils, porcini mushrooms, fine green beans and caper sauce. Again, that's our vegan option. Or you could have, for a fish option, you could have the pan-fried sea bass served with crab tortellini, butternut squash, chilli and lime puree, sauté pak choi and coconut and coriander dressing. There's quite a lot going on in that one, isn't there? Yeah, it does sound really nice though. Okay, so we also have a slow-cooked featherblade steak with a pepper cream, char-grilled vegetables, roasted new potato cake, fine tomato and shallot puree. Yeah, that's it, that's those. And then for our dessert, if you are fancying dessert as well, you could have perhaps a salted caramel brownie with clotted cream ice cream, a trio of deconstructed Eton mess, lemon posset with minted raspberries and strawberry and yoghurt ice cream. So those are kind of smaller sized individual portions of each dessert if you fancy something a little options on one plate. And then finally there is also the option of an apple mousse with a toasted oat crumble and vegan dark chocolate. And again, that one's a vegan option for you if you would so prefer. Do you know what you might like? Okay. Not sure? How about if I pass you the menu just while I answer this call? Of course. There you go, you have a look at that one for me. Hello, Treasury Sleep Clinic. How can I help you today?
Oh, hi. I'm calling to inquire about the vacancy for a sleep technician that you have available.
Of course, yes. I'm just loading that one up on our system now. What would you like to know about it?
I actually wrote about the development of sleep theory for my master's degree. I'm just wondering what the hours and shift patterns are like.
Wow, I can imagine that must have been a really interesting master's degree.
Yes, it was. I really enjoyed it.
Yeah, I bet. Okay, well, it's a full-time position that we're offering, so you would be working 40 hours per week. The clinic is closed at weekends, but we are open 24 hours a day, Monday to Friday, because we do carry out some overnight sleep assessments for some of our patients here. The shifts are 8 o'clock in the morning until 4 o'clock in the afternoon. We then have a 4 p.m. shift until midnight, and we also have a shift that is then midnight until 8 a.m. so we cover the full 24-hour clock with our shifts. We run those shifts on a weekly basis, and they're rotarised then each week, so you take a different shift each week.
Great. I have a CV and a covering letter addressed to Dr. Treasury. Is that okay?
Absolutely, yeah.
And what would be the best email address for me to send that one to?
It's recruitment
Yep.
at Treasury Sleep Clinic
Yep.
.org.uk.
I'll get that sent through now and I'll look forward to hearing from you.
Fantastic. We'll be in touch soon.
Bye.
Bye. Okay, sorry about that. Did that give you time to look through the menu and make your choices? Yeah? Wonderful. Okay, let me just get you back open here. There you are. So, what would you like for your starter? Okay. And how about the main? Yeah, good choice. And then did you want to go for dessert as well? Yeah. And which one would you like? Okay. There we go. So that one is all in for you. Do you have any allergies or anything that the chef needs to be aware of? Any dietary requirements? Okay, lovely. If I could just take a payment card from you. Great, thank you. Okay. Lovely. So I'm just going to add this one onto the system. The card won't be charged until later this evening once you've actually had the meal, and it's going through us, so it will show up as Treasury Clinics on your bank statement. Okay, so let's just put this number in here. And the expiry date is 03/27 and a 3-digit security card 331. Okay, lovely. Okay, so that's all added for you on the system there. I'll book that one in for about an 8 o'clock delivery to your room. Does that sound okay? Yeah, we can make it later or earlier if you prefer. No? Okay, well if you do change your mind, just give us a shout and we can reorganise that for you, alright? Good, okay, so just put 8 o'clock on there and we'll send that through to chef now. Lovely, right, that is all done. We just need to go over your pre-operative medical consent form and health questionnaire, and once we've done that you'll be able to go up and get yourself settled into your room. Do you have any questions for me though before we get started with the questionnaire? Sure? Yeah, of course. So once you're checked into your room and you're feeling comfortable, you're going to have perhaps an hour or two before we really need to do anything. So the nurse will come to your room, just knock on the door at around about the time they want to take you down to get you ready. It's a local anaesthetic only, you won't be having a general anaesthetic. So they will take you down to the room where the procedure is going to take place and they will talk you through the procedure itself. I'm sure you've had the information already, but they will go through it again anyway, just to reassure you and of course answer your questions about it. Okay, that's it, yeah. So it takes about an hour for this procedure normally. So you will have the procedure just for the hour and then it's going to take maybe another hour or two for that local anaesthetic to wear off. So we recommend during that time that once you're taken back to your room, you just take it really easy, stay in your room, relax, call us if you need anything at all. And then when you start to feel the effects of that local anaesthetic wearing off, you can think about perhaps having a walk or something like that if you'd like to. Yeah, absolutely. So that's the point at which people would normally return home, but I don't blame you at all for booking the extra night stay, a bit of quiet time for yourself while you recover, so you can make sure you're feeling at your absolute best tomorrow. Good. Okay, right. So we have a digital consent form for you now. So I have an app here on our tablet. I'll just get this one loaded up. Okay, so it's a straightforward questionnaire. I'm just going to run through the questions with you and then at the end it will just take your signature. Okay, that's it. Alright, so let's get started here on this first page. So of course we have your name and we have your email address already. I'll put those in a moment. What is your height? Okay, and your weight? And what's your date of birth? Good, I have that on the system. Okay, lovely. And do you have any existing heart problems that you're aware of? So, have you ever had a heart attack? Do you get murmurs, angina, any blockages? Okay, have you stents, irregular heartbeat, heart surgery, heart failure? Okay. And do you have ever had high blood pressure? Okay. And how about experiencing chest pain or breathlessness after climbing 2 flights of stairs or more? Okay. And do you have a pacemaker or an implanted defibrillator? Do you take aspirin regularly? Okay. Are you on a prescription for blood thinners? And do you have an artificial heart valve? Okay. Are there any other artificial implants relating to your heart? Any other heart issues at all that we haven't covered there? Okay. Right, I'm just going to ask you some questions now about your breathing. If you're not sure, you can just answer not sure and we can put that on there. Anything that you'd like to discuss further with the doctor, they will discuss with you anyway at the time of the preoperative assessment, okay? Good, okay. So, in terms of your breathing then, do you have emphysema or chronic obstructive pulmonary disease or chronic bronchitis? Okay, and how about asthma? Have you ever had asthma? Did you suffer from asthma as a child? Okay. And how about sleep apnea? Okay. Do you have any problems laying flat for at least 30 minutes because you have difficulty breathing? All right. And in terms of breathing as well, do you use a breathing machine at all to help you sleep? Okay. And do you ever use any inhalers? Okay. Do you have oxygen at home to help you breathe? Okay. And do you smoke tobacco of any kind? Cigarettes, cigars, pipes? Okay. Have you had shortness of breath for which you have been admitted to hospital in the last 2 months? All right. And have you had pneumonia in the last 2 months? Okay. Do you have any other breathing issues that we haven't covered there? Okay, good. Right, moving on then to blood problems. Have you ever been treated for sickle cell anemia? Okay. Anemia at all, as in low blood count? Okay. And have you got a bleeding disease or problem? No. Blood clots in your lungs, legs or any other area? Okay, and have you had a blood transfusion within the last 3 months? Okay. Do you have any personal or religious reasons for refusing to have any blood products given to you? Okay, lovely. I know a lot of these questions aren't relevant to the procedure you're having, but we have to ask them anyway as part of the process. Okay, thank you. Okay, so in terms of neurological conditions now, conditions affecting your brain, do you have currently or have you ever experienced memory problems or confusion? Okay. And any detail on that one? Okay. Okay, yeah. Have you ever had a history of extreme confusion after you've had an operation? Okay. Have you got a disease that affects your muscles and nerves? Have you had a stroke or stroke-like symptoms in the past? Okay. What about any aneurysm? Epilepsy or convulsions? Dizziness? Okay, and any fainting spells? And when was the last time you fainted? Okay. Have you had any family members who've experienced a serious issue following having had anaesthetic? Have you had serious problems yourself following any anaesthetic? Right, okay. Do you ever have any trouble opening your mouth, jaw, or moving your neck? All right. Do you have chronic pain disorder? Are you pregnant? Is there a possibility that you could be pregnant? Are you diabetic? Okay, are you on dialysis? Do you have kidney disease, thyroid disease, urinary tract infection, an infection requiring isolation in the hospital? Do you currently have a cold, chest infection or fever? Okay. Have you had an organ transplant? Okay, do you have stomach ulcers, arthritis, autoimmune disease? Have you ever had radiation treatment? Do you drink more than 14 alcoholic beverages per week? How many units on average do you drink per week? Okay. Do you have a hearing impairment or wear a hearing aid? Okay, and I'm just going to run through some allergies with you as well. Alright, so do you have allergies to latex? No? Okay, how about eggs? And any other food? Okay, how about medication? Any metals? Anything else? Okay. So just a bit of hay fever sometimes. Thank you. Okay, do you have any issues with your balance? Okay, and have you had a fall in the last 3 months? Okay, and do you have arrangements for getting home tomorrow? Yeah, okay. You'll be absolutely fine to drive by then, that's not a problem. And have you had any other surgeries or minor procedures in the last year? No, okay. Are you on any medications at all at the moment? Okay. Yep. Good. Alright, and are there any other illnesses that we should know about? Alright. So I'm going to tick to say that we have filled this questionnaire together. And then just at the bottom here, I just need you to print your name and then you can sign with your finger. Alright. Lovely, I'll just pass that one over to you. Okay, is that alright there for you? Good, that's it. So just type your name in there. Great, and then if you just draw your signature in this box here. Lovely, and then if you just tuck the date into that box there. Great. Okay, that is that one all done. I know that's quite thorough, and there are a lot of questions there that aren't relevant to your procedure today, but it's just for our records really to make sure we have any and all information that might be relevant. Absolutely. Okay, so what I'm going to do now quickly is just get a hold of the concierge, so it won't be a second.
Concierge.
Hi there, I have a patient here ready to be taken to room 44.
On the way.
Thank you. Alright, so the concierge is on the way, so they will direct you to your room and they will also take your overnight bag for you so you don't have to carry that one. Okay, good. Well, if there's anything else that you need in the meantime, whilst you're waiting for your procedure to start or afterwards, you can always call straight down to me and I will be here to answer your call and answer any questions that you have, alright? Lovely. Well, I hope you have a restful and very comfortable stay, and I will see you again very soon.